Let's get this party going. My name is Devin Desjarlais, and I am the director of marketing and storytelling at United Way of the Greater Triangle. This is actually our first Unwrapped conversation of the season. This is a series that we started last fall with the intention of and the hope of being able to connect our donors and our audience further to the incredible nonprofit partners that we work with. United Way funds nearly 100 nonprofits in the Triangle. These nonprofits have been vetted through a team internally and then external volunteers totaling more than 300. These are the greatest organizations with the biggest impact that we have found in 4 counties: Wake, Durham, Orange, and Johnston. We want to bring their expertise to the table in a way that matters and along subject matters that are relevant and important to you all. So for those of you who aren't familiar, United Way of the Greater Triangle has the bold mission to eradicate poverty and increase social mobility through the power of partnerships. And with that mission, we serve a 4-county region, which I just mentioned. It's Wake, Durham, Orange, and Johnston counties. And in pursuit of that mission, like I said, we fund nearly 100 nonprofits working on the ground to support our neighbors in need and the challenges they face. So some of those challenges, like lack of affordable housing and nutritious food, quality educational opportunities, and others, existed long before the COVID-19 pandemic. These are certainly not new, but it will probably surprise exactly none of you that when we say that the pandemic hasn't made anything better. So I'm pleased today to introduce you to 2 leaders who have from nonprofit organizations that have gone above and beyond to support our neighbors through the incredible trauma and burden created by this global crisis. And today we're not just focusing on the challenges that have been created and really exacerbated over the last year and a half, because there are also additional challenges that have been created, but we're focusing on what we've learned, what has surprised us, and what's worth taking with us into the future. We recognize that everybody is sick of hearing about the fact that COVID still exists. Everybody is sick of hearing about the trauma that we've all experienced during the pandemic. And what we hope from this is that you will not only walk away from this with a better understanding of how these 2 nonprofit partners are supporting our most vulnerable neighbors, but also inspired by the solutions that they've been able to create and implement because the pandemic existed. Taking a look at that silver lining, if there is ever one that existed, perhaps we can find it together. And before we get started, I want to acknowledge that one of our panelists, Amy Schmidt from NAMI Wake County, who's also one of our 10 to Watch leaders, had a family emergency and will not be able to join us today. This is an example of mental health in action, and it's so important to take care of yourself always, but especially during hard times. And we're glad that she's able to do what she needs to do. So without further ado, please join me in welcoming Tomeika Watson. She is a licensed clinical social worker at the Center for Child and Family Health and also the manager of their Healthy Families Durham program. Cynthia Vargas is the community health worker at one of the community health workers at Student U. She's also a Student U parent and an employee of KIPP Durham, which is a charter school. So give a little round of applause. Even though we can't see you all, I am going to trust that you all are as excited as we are to be here. And before we get started in asking them questions, I'm gonna launch a little poll here. And if you all can just chime in and let me know what you think. The Kaiser Family Foundation polled community members in December 2020 to see how household income during COVID-19 impacted mental health. Of all the adults that reported household incomes of less than 40,000, 56%, so more than half of the people in this with household incomes under 40,000 said that worry or stress related to COVID-19 has had a negative impact on their mental health. How many of those that reported having a negative impact reported that it was a major negative impact? And what we're looking at here is a direct connection between the amount of money a household makes and their experience of trauma and mental health challenges as a result of COVID. So got 60% participating. Let's give it another couple seconds here. A lot of you think 42%. The rest of you think 35%. One person thinks 18%. But I do find it fascinating. I just want to point out here that nobody thinks 12%, which is the lowest number that we offered here. Nobody thinks, okay, well, it really wasn't that bad. But you guys are seeing the connection to poverty and mental health. So I'm going to go ahead and end the poll here. The answer here is 35%. And I'll go ahead and share the results so you guys can see it. Of the households making less than 40,000 that reported worry or stress as it related to COVID-19, 35% of those people reported that it was major. So just let that sit with you guys for a second here. So now I want to get into questions of our panelists. Thank you both for joining us. Tomeika, I'm going to start with you here. You are a licensed clinical social worker at the Center for Child and Family Health. Can you, first of all, tell us a little bit about Healthy Families Durham and what that program does and who it supports? Let's start there.
Yes. So, well, great to be here. And thank you for having me. So Healthy Families Durham provides home visiting for moms and babies or parents and babies in Durham between 0 and 3 years of age. So we start our services when the baby either prenatal or 3 months of age, and then we visit them up to 3 years of age. So we do case management, we do developmental assessments, we also do goal plans with families and just provide support because we know parenting is challenging, and just provide developmental information and community resources for those families. So that's in general what we do. We have about 10 family support workers that work in Durham County currently that provide services in Spanish and English.
I love that accessibility. I actually have 2 young children myself. One is just past 3 and one is 5 months. And it is tough no matter what circumstance you live in and what experience you're having to raise children. And, to be able to have that additional support from people who are experienced and experts with children and families has got to be so invaluable. And I love thinking about that for those families, especially knowing, my own experience in that realm.
Yes, definitely. We find our families, we are there to support them in whatever they're doing, and help lead them into the things that they want to do. So yeah, we really enjoy it. I've been doing it 18 years now. So I've been with Healthy Family. Yeah. Wow, and I'm only 18. So
so since birth. That's
yes,
amazing.
Since birth I've been doing it. Yes. So a really wonderful program.
Fantastic. And how have the families that you and your team support, how have they changed like during the pandemic or as a result of the pandemic? Either their challenges or, however you want to answer that question.
Oh, yeah. I mean, I will answer in both ways, challenges and resilience. I will say our families have been facing. I will say just, with the onslaught of the pandemic, it hitting all of a sudden, we had to pivot to virtual visits, and we're used to being in the homes, being in the spaces where families are, wherever they are. And so to be able to pivot into that virtual Zoom and WebEx type visits was challenging for not only for the families, but also for staff, and just being accessible to be able to do that has been also hard, and just kind of guiding them and connecting them to resources where they can. Many of them who have older children as well had to hunker down, do stuff at home. So we were just there to provide support and listen to some of the challenges they had, and help them navigate through this, through the pandemic. I will say that's one of our biggest challenges with the technology and them accessing. But I will say about 70 to 80% of our families we serve over 3 years are still with us, in spite of us continually doing virtual visits and things like that. So it leads to just knowing how resilient that they are, and how important are the work that we may do with them as well, for them to still stick with us, because our program's voluntary. They get to decide, when they want to start, stop and things like that. So it's been challenging, but yet their resilience have shown through as well.
Thank you for sharing that. You touched on something that I think is easy for a lot of people to forget. For a lot of us here, Zoom is a part of our daily work life. It's something we have to do and not necessarily something we want to do. And one thing that we keep hearing from nonprofit partners over and over again is how the switch to virtual, despite it being a challenge to figure out and overcome so quickly, because nobody gave us really a ton of advance notice that this pandemic.
No, they didn't.
Like we had a runway to figure it out and figure out Zoom. But the virtual visits have made access to healthcare so much easier for people who are experiencing poverty in particular, because there's so many, like, people like to say we have the same amount of hours in a day as Beyonce, but that's not really true. Beyonce has so many people to help her.
She does.
And people who are experiencing poverty are often, they're having to navigate systems and complications that somebody who is not going through that experience doesn't have to do. And when you take away the challenge of having to drive to appointments, to having to wait in the waiting room, find sitters for your kids, or bring them with you, even if you don't want them to hear about what you're going through. I mean, there are so many more complications, and that removes a lot of that. And it's really quite beautiful.
Yes. And I definitely see that as something wanting to be taking away from the pain. I mean, there's lots of challenges for the pandemic, but also like figuring out what things work, and we can continue, like even with our program, we follow the Healthy Family America model, and virtual visits were always there, but it wasn't something we ever touched in on. And now we can see it as being so as a way, like when there's snow days, like there's no snow days, we can access with people, meet with them virtually, and then being able to, for families that live pretty far away in the country and may have some issues with us getting out there or whatever, construction, we can still find ways. So we just recently started trying to do back in-person visits and trying a hybrid model, and just being able to have that as being another option is fantastic. And I will say, families too, we do a lot of screeners within our programs. We screen for substance use, domestic violence, and other things, and to be able to also screen or give referrals that can meet families' needs virtually has opened up the windows for some of those things you were saying, like the hesitancy, or them being able, like, how am I going to meet? I have to work from, this time to this time. Maybe I can meet somebody virtually on a lunch break while I'm doing that. So that has opened up some doors for families. And I think families really appreciate that. We even see it in terms of when we are meeting, families are multitasking, but we're still being able to meet with them even as they are multitasking. So I do see some that as being a positive to all the things going on.
Absolutely. So really quickly, two notes here for everybody who's listening. And one, can you hear us okay? I've gotten a note from somebody that their audio wasn't working, and I want to make sure that's not the experience that everybody is having. If y'all can just drop a comment in the chat and let me know. Fabulous. Thank you, Nathan. Just wanted to make sure that wasn't the experience everybody was having. I figured somebody would have told us eventually, but I appreciate that. Thanks, everybody. And then the other thing I want to point out too, we're going to have Q&A at the end. So if you have any questions for the panelists as we're going, and you're like me and you have the memory of a goldfish, please feel free to drop it into the Q&A section below. We'll read from those once that time is ready. So feel free to dump them in there. Thank you, Tomeika. I'm going to switch over to Cynthia really quickly. Cynthia, I'm really excited to talk to you because the whole idea for this conversation came from a meeting that I had with Brandy at Student U. And we were talking about, we hadn't seen each other in so long. And we were talking about the different experiences that we'd had since we'd last seen each other in person prior to the pandemic. And I wanted to know, what is it? Like, what has Student U done? How are you connecting with families? How did you support families and connecting to resources at the beginning of the pandemic, especially as schools were shutting down and switching to virtual, and parents maybe were out of work? And she told me about these 2 community health worker positions that Student U opened up, of which you are one of those community health workers, which is so cool. So Student U, just to kind of give everybody a little basis here, Student U empowers and equips first-generation college students in Durham public schools, their families, and educators to become the leaders that will transform our city for the better. You are one of two of the parents that were hired, student U parents hired at the beginning of the pandemic to help create a comprehensive database of community resources and organize the distribution of those resources to families. And correct me if I'm incorrect on any of this, please. I really want you to tell the story in your own words here. But can you tell me a little bit more about why that was important and why you chose to take on that role and what you learned in the process?
Sure. Thank you for having me. This was important to me because in order to best equip our students to become leaders, they must foster an overall round of skills, and that includes the ability to maneuver through systems often hostile to people of color, and knowledge and skills used to challenge the inequalities and oppression. And when COVID cases began on the rise, affecting people of color at disproportionate rates, I decided to take on the role to use my voice and skills to help bridge affected families with the health education and those community resources. And I learned how important the community health workers are to bridge that gap and make that direct impact overall for our students and families.
Thank you for that. And tell me a little bit about, what did you do in this role? And also, what are you still doing? Because you are still a community health worker with Student U. That need has not gone away. What did you do, and what did that look like? Paint us that picture.
Yeah, so we do a little bit of both. We're on the education end of the community health work. And when these two positions came open, we started seeing the need for families that were actually being affected by COVID and how that had a negative impact in students and their learning. And so we immediately started navigating through how to continue to have direct connections with students who were remote, which was a little harder because there was no in-person contact. Home visits were restricted at the beginning of it. And so immediately when we started navigating through those, Zoom was a big save. And there was a need also for bilingual community health workers, because there is a huge gap with the language, and not only the language, but a barrier with, tech savviness. And not everyone is tech savvy. And so we were fortunate enough to be able to do that for our families. And once we were checking in with students as well as school counselors, we then moved on to connect with families as well, and just asking directly each individual family how they were doing, just as a pulse check overall. And one of the things that I learned during this time is I admire our families and just people in general, how selfless they can be even in a time of need. And so I learned that we had to verbatimly let families know, like, there's help exclusively for you, like this is already in place for you. And if there's a need, it's for you to use. Because a lot of the times, speaking to families who had been affected, they had lost their jobs. They couldn't find resources to either get tested or vaccines. And it was always that humble piece of like, no, I don't need it. Someone else might need it. Go ahead and give them, someone else. And that was very eye-opening for me. And I learned that we as a community need to do better in learning how to accept help overall. And so once we navigated and started connecting directly with parents, and we began having a resource list that we would share. And that also included translating for our families, because these resources were accessible, but not in a way that they could navigate and receive the resources. So a lot of the times we were the advocate they're translating for families or even navigating with whoever the other representative was, and ensuring that they were able to access whatever the help was for them.
Thank you for painting that picture. I want to call out for folks in the audience here. I'm making an assumption, right? I'm making an assumption that the majority of the people registered for this are English speakers. And think about the systems that we all move through on a day-to-day basis. Think about where you shop. Think about the emails you get from local stores. Think about who you talk to at your kids' schools or at your work. And a lot of those systems are designed for English speakers and designed for people who are familiar and comfortable with the systems that were created. And so now imagine that you are not, maybe English isn't your first language. Maybe you weren't born in the United States. Maybe you don't have that comfort level with the systems. You don't see yourself in the systems you have to move through every day. And think about what an extra challenge that would be. And then to have somebody who's an advocate who can walk you through and say, oh, no, you don't need to worry. Like, you can feel comfortable with me because I have had the same experience that you have had, or I speak the same language you speak, or I understand what you're going through. And to be able to lean on somebody, that's invaluable. Like, think about who we lean on every single day. No matter what language you speak or no matter where you live, there are people you lean on and people that you're comfortable with, and not everybody has that. And so I just want to lift up Cynthia here and the work that she's doing, because it is just so incredibly important beyond the resources that she and her colleagues have created, beyond the relationships. Like, what all of this stands for is really, truly incredible, and I think is worth elevating here. Thank you, Cynthia. This is a question for both of you here. So United Way makes it a point to have what we call site visits, which are really at this point more like site visits and not like in-person visits, because we're doing them all over Zoom. But we're doing site visits with every single one of our nonprofit partners. And we started them several months ago, and they're going to go through December. And in every conversation, we make a point to ask our nonprofit partners, how are you doing? What are you doing for yourself? Because it is so easy for us to forget to take care of ourselves as we are pursuing taking care of other people. So I want to ask both of you, what does mental health and wellness look like for you within your line of work? And also, how do you care for yourself while also caring for others?
That's a great question. And we had our site visit already, and I appreciated people asking that question, because it is very important. And I mean, we've always known it. As you mentioned at the start, like COVID just highlighted things that have been going on previously, and also exacerbated challenges. I will say for our group, and for myself, I think it's divine intervention. Right at the beginning of the process of COVID, we had just joined in a mindfulness cohort through 0 to 3, a national cohort around mindfulness and bringing that into early childhood education and how to bring that into workers and also families. And so we had just kind of ventured into that within our group, and they were thinking of canceling it. And I was like, no, this is a perfect time. And so we really dived into what that meant as one strategy in self-care, and really have utilized it as workers, as support of families and supporters of families to help. So we do that within meetings. We do that within our daily staff meetings with families as well, and utilizing just all the different practices within mindfulness that you can use. And that's really, for me personally, it was just really helpful with the start of just some of the chaos of the pandemic, and we continue it now. And the importance of, like you said, being able to take care of ourselves to be able to support families, and vice versa, that parallel process for them to take care of themselves to be able to take care of their own family. So we try to model that, but also introduce it in when we are meeting with families and things like that. And so for me, that's what I've been doing really in many different levels. And that's been very helpful and very important to be able to move in this space of ongoing trauma, as we all are, experiences in different levels with the pandemic. So that's kind of what I've been doing.
Thank you. And Cynthia, what about you?
I think overall as an organization, or at least among like my colleagues and our team, we're constantly doing a pulse check. We check in with each other twice a week, and we start off with how are you doing, and allowing that space where we can share and just get it off of our chest. Sometimes, day to day gets away from us, and it's something, I'll be honest, personally, is something that I am still continuing to learn to do, is allowing myself to self-care. One, not only with my job, but I am also a mom of 3, 2 of them teenagers. And so I have to model that. And aside from those 2, I work at a middle school again. And so I have 350 other students who we have to model these skills for as well. What does it look like? And so with our families, having those conversations of allowing and giving ourselves as adults permission to stop and breathe and look back. It doesn't necessarily, even though it feels like it at times, that we're always on the go, is just give yourself 5 minutes when it feels like that, and just find a place, hide, take a breather, and then move on. And that's something that I've gotten in the habit of doing, including with our kids as well, is just having these conversations again of like how important it is to take care, and how mental health is an overall wellness. It also affects your physical health, and it's all tied in. And so we have to make sure that we're taking care of all of ourselves in its entirety.
Absolutely. Thank you for that. And it's not lost on me either, in the positions that both of you are in, and even in the position that I'm in as well. When you are a leader, not only within your organization, but also within your work, and also as a parent, and also, self-care is something for you, but it also becomes something for other people. And it's not lost on me that it's not as easy as saying, you know what, I'm going to close my door and I'm going to take a nap, or I'm going to close my door and I'm going to read, or I'm going to take some me time, because there are always those responsibilities. And it's kudos to you all, for you two, for figuring out how to carve out that time, and recognizing that that as a model for young people, like we can create futures in which the next generation has a chance to thrive and excel. And part of that is from the work that we're doing, and part of that is from what we're modeling. And that's also really important. So last question here. We talked a little bit at the beginning about how folks are really kind of tired of talking about the trauma of the pandemic. But there are so many silver linings that we could also lift up. What might the audience be surprised to learn about your collective experience during the pandemic? And what did you learn during this pandemic that you plan to take with you into your future work?
I could go, or Cynthia, if you want to go first. Oh, okay. It's a really interesting question, because I think I'm like, oh my goodness, there's so many surprises. I think one of the surprise for me personally is, as I look back, I thought, oh, this will be a 3-month thing. This will be a 4-month thing, and the longevity of all the things that's going on with the pandemic. What I think surprised me in some ways in the work that we do, and work what we do with families, we all come into this work with our own experiences, our own thoughts and feelings and backgrounds, and oftentimes they are parallel with families that we work with. Sometimes they're different, but I will say that the pandemic brought a sense of, yes, there was a lot of trauma and things going on with it, but it brought a sense, I think, of connection with the families that we serve. I mean, and not even the family, just with, I think Cynthia mentioned, just with others, like just being with others in this time where it's so challenging. And in a way that I don't think anything else has, and just being to identify and be with other people you work with or families you're working with, like we're in this thing together. So the sense of togetherness and the sense of like we support each other. And so that was a little surprising yet, but not surprising, I guess, because, you know, just people have been just so resilient and has really been able to open up. The conversations at the time just about the, you know, equity, the inequities that's going on, continues going on, that was going on before the pandemic, and just all that just heightened. It just surprised me, the openness of everyone in our families and how we're working with families. I just think it's bring a different sense of that. So, and I want to continue that in terms of the work or interaction with families and the work we do with others.
Absolutely. Yeah, in a way, this whole experience has slowed things down and also sped things up simultaneously. And I'm with you where it's that camaraderie, you know, if we're all going through this experience together, and yet in very different ways. And we feel that at United Way too, the sense of community that I don't know that we felt beforehand, and I hope my colleagues who are listening to this don't take that the wrong way. But that I definitely feel a closer connection to my teammates, to the nonprofits that we work with, and I agree that I don't want to lose that at all. What about you, Cynthia?
One of the connecting pieces with learning to stop and take a breather is building relationships, is getting to know other people. And one of the things that I've learned in this work is how important it is to build those relationships. And in order to be able to help our families, is that they needed to gain our trust in order to feel comfortable and allow themselves to be more vulnerable and accept the help. And so that's something that I am constantly focusing on, and I am building that with kids as well, with our students, on how important it is to build relationships, even though we were in a remote learning setting. That was one of our focal points with colleagues overall, is like making sure that you're building these relationships with students, because at this time they couldn't leave their home. And some families, some students don't have a complete family, or they don't have what others would have. There's an equality, right? And so sometimes being in school, they have a student has a person that they can feel comfortable or trusted by. And when you're out of your space element, then that's taken away from you. And so I now am, I'm not a very social person, but I've come to learn how important it is to build relationships among the people we work with, our own families, and in our work as well that we do. And one of my colleagues was, she shared with us, Andrea, she's one of the other community health workers, that on a larger scale, our world is very fragile, and that there's a lot of work that needs to be done. And it does not stop just because the pandemic is slowing down. All these needs were there prior to the pandemic. And what the pandemic has essentially done is just made us more aware of it, and bringing more resources to the table for these needs, and making people aware and open to the conversation to continue to bridge this gap.
I think you hit the nail on the head there. Absolutely. And I also want to call I really appreciate what you just shared and the story. I know it's not always easy to talk about these subjects, and it's not always easy to talk about them from a personal perspective, because there's a level of vulnerability that comes with that. But you said something that I wanted to highlight for the audience here, or it's actually more the way you said it. And I'm going to go back to referencing kind of the experience of poverty, because that is United Way's mission, is to eradicate poverty and increase social mobility. You know, when we're talking about individuals and families as a community going through the experience of poverty, that often tends to get boiled down to numbers. Like, you know, this many people are experiencing poverty. This percentage of kids don't have enough healthy food to eat every day. But what gets lost in that are the people, right? And so what you just elevated is the need for these trusting relationships, because there are real people behind these numbers. There are real people behind these relationships and these stories who have real feelings and real distress and real fears and real hopes and dreams and all of this, who want the same things that everybody else wants and have the same dreams for their kids and for themselves. Not exactly the same. Everybody has different dreams, but like, I don't know that anybody dreams of experiencing homelessness. I don't know that anybody dreams of having one day where they don't have enough food to eat. I think we all dream of having safety and security and excelling in life. And I just think it's always helpful to lift that up and to remember that as a community. So thank you. This is the part where I open it up to anybody who would like to ask questions of Cynthia and Tomeika today. So if you do have questions, feel free to drop it in the Q&A box below. And if you don't, that's okay too. We're not going to force conversation, but you know, I could blabber all day, and I'm sure nobody wants to hear that. A little bit of a timid audience here, maybe. Tomeika and Cynthia, is there anything that we have not asked about that you want to talk about in relation to the subject? And also, we have a question. So if you don't have anything that comes to mind, I'll throw out the question. So Brandy wants to know, can you share your most hopeful memory or moment during the pandemic?
I don't have necessarily one specific memory, but it's more of an overall when our families have received help or resources that was a hardship for them, for their family in the home, and just what we would give them. It was the joy of like the relief of having these resources. And that for me was, again, invaluable. Of, you know, there's nothing that can bring, there's money can't buy that, to relieve to a mother or a parent, you know, to know that we have food for the next week. Or I can call on one of the community health workers when they don't have anyone else that they may be able to get help from or feel comfortable doing so. And so that for me was just an overall takeaway of how valuable the work that as community health workers, or even just helping frontline workers, are doing overall in the community.
I think for me, definitely what Cynthia said. I think some of those, we have many stories of some of those basic needs that families have, and just be able to have those taken care of when there are so many other things going on for them. has been tremendous. I think about one particular story of a family that we had been seeing previous to the pandemic, and how we had only been doing phone calls because she wasn't as savvy as Cynthia. I like how you said that, technology savvy. And so we had this grant that provided us, finally, everyone's scrambling, trying to figure out how to support workers and how to support families. And this grant was able to provide us with some not iPads, but some kind of tablets. And we got her connected. Like, it took like a good 6 or 7 months, like within that time, but she finally got connected with one and was able to. And so we visit, small babies. And so the last time the worker had seen the baby was like, 3 months of age. And then when she saw it, was like, they're doing all these things, and how this mom finally got connected. And it was just so exciting, something so small and simple, but so important. And she was able to navigate other things now that she had this access to technology, like a lot of things went online to fill out, and she couldn't really do it on her phone, and didn't really. So that piece of it, that was like a highlight, like those, like, even though it may have taken some time, that families reached success in whatever they were doing. It could have been small, big, in spite of what was going on in the pandemic. So, yeah.
Thank you both for that. The next question somebody asked is, how have your individual lived experiences motivated you to do what you do?
I'll go with that. I've been doing this work for a pretty long time, and what has made me continue in terms of my lived experience, I can see myself in many families that I serve, and see the same thoughts and hopes and dreams. And it's just the resilience of families that keep me in this work. And I think in some ways also the resilience that I have faced myself. So that has really been in how just what Cynthia said, I think is so important, just the relationships, and how important like building a relationship with a person is, and how that can help you in a non-judgmental way, how that can just really help and motivate you to reach your goals and your dreams. So that has kept me in this work for over 18 years. And just the awe that I have for families that I get to work with. And I truly enjoy that, and being just a small part of their growth process, or their process in parenting. So yeah.
Thank you.
For me, I've been in education for 7 years now, and it's very unfortunate to see some of the things that children go through at a very young age. A lot of children, not every child has their parent. Some are with guardians. And so it changed the way how I wanted to show up for children and their families, and how can I best support them individually, overall, just opening a whole other perspective. Even though I have my own children, I wanted to give more, because I felt like I was fortunate enough to be able to take care of my children in a way that other children didn't have. And so how I show up for children has continuously to improve, and there's always going to be room for improvement. But being that person for children and their families of support.
That's really quite beautiful. I'm getting a little emotional as somebody who has young children, to think about kids who don't have that kind of support, kids who don't have the stable family life, who don't live with their parents, who don't have a safe, comfortable bed to sleep in. I mean, that's hard, right? It's hard to think about. And it takes somebody with a lot of love to be in a position and do what you do. So thank you for that. And the last question we have here is for Cynthia in particular. And I do know the answer to this first question, but I'm going to read it all in full so that you can answer it in your words, because it's your story here. How has Student U always had community health workers? And if not, how do you see the long-term integration of these positions into the mission of Student U?
So I have not been with Student U for that long. We're now going, I believe, a year that I've been working with Student U as a community health worker and as a parent as well. But I think this opened up a need and a different perspective of how can we best support our families and our families of color, for that matter. What are those needs, and identifying specifically what are those needs that every different community has within our families. And so one of the things that Student U has now is that they are looking into hiring permanent part-time family advocates. And so even with family communication, sometimes families aren't available during the day. And so being able to provide accessibility for families after hours was very important. And that is something that with this, I believe that we're going to continue to build and support more families.
Thank you for that. Thanks to both of you, really, and to everybody that was able to join us today. We don't have any more questions left, but I am also going to cut folks off here, knowing how busy both of you are and how, appreciating the time that you've given us so far. So everybody, please join me in saying thank you to Tomeika and Cynthia for joining us today. Thank you to all of you for also joining us and taking time to listen in. If you've learned something new in today's conversation, we'd love for you to join us at the next event, which is happening on Friday, November 19th, also from 1 to 2 p.m. Or even if you didn't learn something new, we'd still love for you to join us. Anybody is really welcome here. For that one will be called Justice Series United for Equity and Education. And we'll be speaking with 3 community leaders about the direct link between education and poverty and how equitable strategies can create communities where gender, race, or resources are not obstacles to achieving education potential. So I'm going to go ahead and drop the registration link for that in the chat here. You'll also receive that via email early next week. So don't sweat it if you don't get the chance to copy it right now, but we'd love for y'all to join us if you can. And just, thank you one more time. I hope everybody has a great weekend, a safe Halloween, and a great rest of the year. We're almost through 2021, guys. We almost did it. Thank you so much.